Okay, it's officially our start time for this webinar. Thank you, everyone. Again, I'm not sure where everybody is from, but good morning, good afternoon, good evening to all of you. Thank you so much for setting a time to join us in this webinar. I'll have my colleague Rachel take over from here and officially start the webinar. Rachel?
Great. Thank you so much, Christine. Hi, everyone. I hope you can hear me well. There's a quote that I love, and that quote says that the greatest problem in communication is the illusion that communication has taken place. And I think that is so real with how we engage people, because sending a message is not the same as making sure that the person the message is intended for has truly received that message. So today we are going to explore how to close the gap between sending a message and making sure that people receive it in a way that makes sense for them. So, at the heart of this session is a simple belief that people should not be hard to reach just because they are offline or in hard to reach areas. So, whether you work in WASH, meal, or both, or any other program, communication is your real frontline. And we are aware that if we do not engage the beneficiaries and participants, then we cannot change anything. It means a lot to us that you've chosen to spend this part of your day with us, and this session is definitely way better with you in it. So thank you so much to everyone for showing up.
Thanks, Rachel. So one of the things that we often hear from our customers or the people that we talk to is that SMS, voice, and WhatsApp messaging tools are not applicable for um, remote data collection because mainly because of the people that they are engaging with, and these people are usually the people who are who do not have access to the internet, who are part of the people who have low literacy and do not have access to smartphones or any phone for that matter, and are speaking different kinds of languages, and so these groups are uh, commonly engaged with by going through a face-to-face engagement or door-to-door data collection. So because of these challenges, now the impact it brings in some impact in your data collection. So because you're not fully utilizing the tools that are available, it could result to incomplete or biased data. It could also lead to high costs because if you're always sending people on the field to do these data collection, that entails you'd have to there needs to be some travel budget and other expenses which are part of this, and doing face-to-face or door-to-door data collection can lead to delays in getting results, and some of the minorities might be excluded. And given that it takes a lot of time and a lot of uh, in-person engagements, it's hardly um, uh, easy to scale up. It's very much not that easy to scale up. And so what we are trying to share with you, the NGOs and the researchers, is that we're trying to share that there are accessible channels that you can use to make your data collection, remote data collection, more inclusive, have a fast and reliable data collection, and of course, a big part of it is also making it easier to scale from 100 to 1,000 and up to 10,000, tens of thousands of people that you can engage with through SMS and voice, and as well as WhatsApp. Of course, WhatsApp would require them to have mobile smartphones and access to the internet. But if in scenarios where that is not possible for the people that you're engaging with, then there is SMS and voice.
Great. So, what can you expect from this session today? We will unpack some of the common challenges that teams face when it comes to engaging communities and how simple tools like voice and SMS can help them or have helped them in the past, and how they've also been able to scale their outreach. We'll keep this practical and also fun, so expect real world use cases from teams that are already using our platform, or these tools rather. And also throughout the session, you'll get tips here and there to help you navigate communication challenges. And the fun bit is we'll do a live demo where you'll actually want to just steal some of the ideas, but also, most importantly, it will help you see the tools in action. And the important bit is that we would also love to hear from you. So throughout the session, if you have any questions or you have any feedback along the way, just pop them on the question box and we'll have time to answer them at the end of the session. So before we go further, we'll just do a quick intro of ourselves. My name is Rachel and I am based in Kenya, which is a low and middle income country. So this means that I've seen firsthand how easily people can miss out on important information. I lead partnerships here at Engage Spark, which also means that I've had hundreds of conversations with people like you across all kinds of organizations and in different programs like Meal, Wash, or just humanitarian programs. Some are working in conflict afflicted zones, some are working to rebuild communities, and some are just trying to send one message to their beneficiaries, and they hope that that message lands. And across all these conversation, one thing that has always come up is engagement is everything, but it's also one of the biggest challenges that these organizations are facing. So today's session will help us address that. Over to you, Christine.
Thanks, Rachel. My name is Christine. I'm the customer experience manager at Engage Park. I work closely with our NGO partners, researchers, and humanitarian partners that are having projects in different parts of the world, mainly in low and middle income countries. And I make sure that these projects are a success. So I'm there from the initial onboarding through training and even up until the ongoing support until the end of the project. If you've used the platform, if you're one of our existing clients already, so you may have we may have engaged in the past. Or if not, one of our customer support. So we're very excited. I'm very excited to be to be with you here in this webinar to show you how NGOs such as yourselves and researchers are using SMS, voice, and WhatsApp for their communications and engaging people in hard to reach communities.
Thanks, Christine. Okay, so if you are in this session today, then just like me, you are privileged because it's thanks to internet and a laptop or a smartphone that you've been able to log in here today. But many of the communities that you serve, Wi-Fi is a luxury and smartphones are actually very rare. That's why I like to think of Engage Spark as an engine that's, behind a lot of these scalable communications. So we work with NGOs, we've worked with researchers, UN agencies, other social enterprises, you name them all, and we help them reach people who are hardest to reach. So whether they want to send an SMS blast to thousands of people warning them about an upcoming hurricane, or they want to do a voice call in a native language just to explain to people how to go about hand washing steps, if you need to scale your programs, then we are definitely your people. So what makes us different from maybe other platforms? First of all, it's speed and ease of use. You don't need to have a tech team for you to use our platform. You don't need to be a software developer. Secondly, we are super global, and that's like we have integrations with more than 1,000 telcos all over the world. So you should be able to reach anywhere and at the most remotest place in the globe. And thirdly, we have variety. So from SMS surveys to WhatsApp blasts and IVR soap operas with questions, because we have organizations who've actually done that. We give you the tools that actually work in low and middle income country contexts. Okay. So there's also another quote that I love. I actually really just love quotes. And this quote says, don't fixate on the problem. Instead, focus on finding a path forward. Instead of saying, we can't do this, let's just start saying, how might we do this? And this is something we actually hear a lot, organizations or people just telling us we can't use remote tools because our community doesn't read or our beneficiaries don't have internet. And listen, we get it. Those are actually very valid concerns. But here is what we've also seen, that the tool is not the problem, it's how you use it. So why are you using the wrong tool to reach out to maybe the right people? If Asha in the village or your grandmother back in the village cannot read, she definitely can listen, and you definitely have conversations with her and she listens to you. If Joseph maybe in a certain slum cannot, maybe does not have a smartphone or internet, then he still can receive a simple SMS on his basic phone. So I'll have Christine walk us through an example of how one of the organizations we work with was able to meet people where they are with our platform.
Thanks. So one of the research university that we've worked with is University of Greenwich. It's actually a project with the Natural Resources Institute within the university, and their project is mainly about assessing the reliability and effectiveness of remote data collection using IVR. And their target audience for this project are mothers in northern Uganda who have kids that are 2 years old and below. So what they did is they went into these communities in the villages and started enrolling the mom and child pair. But before they actually did this, they they did a training session, an educational in-person engagement with the community, including the husbands of these women, because one of the issues that they do not want to have is having a gender-based violence towards the moms that are going to be enrolled into the program. So they've educated both the husband and wives on what the program is about. Why is the woman receiving a cell phone that will receive a phone call throughout the program, and what's the purpose of it? So just to sensitize everyone on the topic. And they faced many challenges other aside from that. One is that women that are enrolled in this program are not familiar with cell phones because they do not have cell phones to begin with. They do not know how to read, and so what they did is they brought in their own basic phones. They bought basic phones for these women. I think they bought like 10 or 15 cell phones, and then they gave it to the women in batches, because they've enrolled 156 moms into the program. So they made batches, and once the first batch are done, then the cell phones are then moved into another batch of moms. And the whole idea of this is that they wanted to first understand the dietary diversity amongst these women, and to at the same time to understand their hygiene practices, hand washing practices, and educate them about that. Um, that brings us back to our original topic here for wash programs. And so they've for these program, once everybody has been sensitized and understands how the platform, how the program works, and what the moms or the women need to do when they receive the phone call on their phone, then they start rolling out the IVR calls, because these calls are pre-recorded phone calls. I'm not sure if everybody are familiar what IVR is. It's interactive voice response, where you pre-record a message, and then push it out to your contacts. And so these IVRs are, they have 88 questions in these IVRs. Of course, not all 88 questions are being asked. There's skip logic around this, so that moms are only, depending on what their answer for each of these questions, they flow out into the rest of the other questions. So the whole IVR is 23 minutes long. And from this engagement that they did, they found out that they received feedback from the participants that 23 minutes is too long. And so they learned that on their next project, next time that they use IVR, um, they're gonna lower it between 10 to 15 minutes. And from out of the 156 moms that are part of this program, they've received 74% completion rate, which is really high. Even for IVR, we've seen completion rates as low as 20%, even 10%. But this one is really high, partly because of how they did the education piece of the program.
Il y a 32. Ah, il y a 25. Il y a 25. Il y a la reconnaître qu'elle est bambili fournisseur à Natianga.
Okay.
Okay. So yeah, next slide, Rachel.
Yeah, sometimes things actually just feel impossible until you hear someone else has done it. And that's why these use cases are actually very important, and that's why they matter, because they don't just tell us it's possible, but they prove that another person has done it. So even when we get past literacy concerns or maybe network, there's still more barriers. And sometimes the way we communicate to the people we are trying to reach out to just does not connect with them. And this can come from cultural norms or language barriers and outdated methods, like maybe door-to-door visits and paper surveys, which just make engagement inefficient and also very ineffective. So here is a reality check to all of us. Actually, paper forms and door-to-door surveys are outdated, and they are not only outdated, but it's very, very hard to scale up your programs with such methods. And we hear a lot of organizations here. In fact, I'm sure everyone in their company or organization, when the year began, one of the goals for the company was to scale up, whether you're scaling up your programs and just reaching more people. The goal was to scale up. And you cannot have your impact grow. If your impact is actually growing, then your tools also need to grow for you to say that you're now scaling up. Christine?
Yeah, and just to clarify a bit, the idea is also to supplement what you already have, what you're already using. Because, like for the example here with Johns Hopkins University, for their WASH project in Bangladesh, they are still doing door to door engagements with the participants for this WASH project in Bangladesh. But they did an RCT, a randomized control group, where one group are having these one in-person visit, and then another group that are having this continued just remote messaging, educating them via phone calls and SMSs. So what Johns Hopkins did in Bangladesh is that they have this water and sanitation project where whenever as soon as a person gets admitted into a hospital, any of the hospitals that they are running this program in, they have a health worker working in the hospital that then goes into the patient or to the family of the patient, asking them if they want to be a part of the wash program. They call it Dr. Chobi. If you want, you can also look them up on online. The program is called Dr. Chobi. So um and so if a patient agrees to be part of this program, that then starts their 7-day high risk period or window, where that for 7 days they start engaging this person and their household on different tips on how to make sure that they do not get sick again, they do not get diarrhea again. And they are then provided with a wash kit with soap, with a flip book that has the information about the Dr. Chobi program, and then they're like a soap that can easily make bubbles, and then they can put it in their homemade water sanitation in their household. And they are also given what do you call this, the chlorine tablets to help them treat their water in their household. And so after the 7-day high risk period, the patients are then given one home visit. And after that first home visit, they are the messages, the weekly voice calls starts rolling. So they are enrolled into a 3-month weekly phone calls with supplementary SMS at the end of the phone call. The goal is to educate them on how to, use soap when washing their hands, and what best practices on hand washing and proper hygiene, basically. And for each of these 3 month period that they're doing for the program, over the years they've analyzed that, comparing to the control group, they've had 31% reduction in diarrhea cases and 29% reduction in stunting amongst children in the intervention group. The intervention group are the group that are receiving this 3 month long educational voice messages. So they are doing this in Bangladesh. They're also doing a similar project in DRC, but this case study is highly focused on the ones that they're doing in Bangladesh, because it's the one that's ongoing. They've used us since 21, if I'm not mistaken, up until the current, up until today.
Thanks, Christine. So this is where it actually gets exciting, because once you've understood the barriers that I've mentioned, and Christine has mentioned a couple of organizations that overcame their barriers, then we can pick the right tool and we are able to also break through these barriers. So let's meet our three imaginary friends. We have Asha, Joseph, and Mary. So Asha, just like your grandmother back in the village, is able to speak her local language, but she cannot read. So Asha is also able to receive a voice call with a very friendly voice, speaking in her local language, explaining to her hygiene tips. And then Joseph, on the other end, back in a slum somewhere in Kenya, has a basic phone. He does not have access to internet or a smartphone, but he's able to receive a very simple short SMS reminder telling him that today is actually hand washing day. And then we also have Mary, who has access to WhatsApp. And the thing with WhatsApp is, in a lot of low and middle income countries, Kenya being an example, I know Nigeria is also another example, people or citizens of these countries are actually able to get free WhatsApp and at a fraction of $1. So it's still a bit accessible to some people who are maybe in remote areas. And Mary, who has WhatsApp, is also able to receive a fun video on how they can clean a jerry can properly to just maintain their hygiene. So as we've seen on here, one tool can never fit everybody in your program. Each channel actually serves a very different community, but mixing all these channels then will enable you to meet everyone where they are. And that's exactly how you'll be able to scale up your impact. So Christine will take us through a live demo, which is also the practical part of the session.
Okay, thanks. Now, so I think one of the exciting part of this presentation is the live demo. I'm gonna show you the platform. We've actually prepared a ready-made campaign, a series of campaigns, just so to show you what this will all look like. So here, I've numbered them. They're not arranged chronologically, so we'll just go through them. I'll just walk you through them. So here, just like uh, Rachel's example here, not earlier, not all channels will fit your target audience. It may be that your target audience have smartphones or can spare $1 or two to use WhatsApp, then you have WhatsApp available for you. On the other hand, for those participants who only has a basic phone and can only receive phone call and SMS, then we also have voice and SMS in here. So the first part of this demo here on the platform is showing you how you can actually get things started. So we have an SMS primer here. The SMS primer is what we call it's just an SMS to give people a heads up that hey, a call is coming, and then once they receive that call, they will then the SMS, I mean, they will then be enrolled into an IVR campaign that calls them on their phone and asks them a few questions. First question here would be the language question, and second is how do they want to receive messages from you. Now this is where the different distribution of messaging channels kicks in, because if they say they want to receive messages via SMS, then they will be enrolled into your SMS campaigns here, the baseline survey for SMS, and as well as the SMS drip. And if they say they want to receive phone calls, then they will of course be enrolled into the IVR piece of your campaign, and then the IVR drip. And then if they say WhatsApp, then of course they'll be enrolled into WhatsApp. So the baseline survey here for these three is just for you to, in case you wanted to do a baseline survey, just to gauge what their current learnings are, what they know at the moment, and then you wanted to do an evaluation at a later end, do an endline survey at the end of the program, then you can create a duplicate of this to ask them the same question to see if there's been a change in their responses after they've gone through your program. So and basically the once they've answered the survey, they are then enrolled into a drip. A drip is your educational piece. Like this is where you try to change your behavior, try to educate them on the different hand washing practices and how to keep their household clean, so nobody gets sick in their household. And now let's open some of them up here. So for the SMS primer, you can see you can use personalization in here. That will have the person's first name. That is if of course you know their first name. When you upload their phone numbers in the contacts page, you have an option to add their first names in there and any other information that you wanted to include. And one thing that I wanted to mention is we will have later on a part where we're asking them what language they speak, but for now this is just an SMS message to give them a heads up that they will receive a phone call. And now after after 2 minutes, they will then be enrolled into your IVR language question. Now, the IVR language question is the campaign where you're going to be asking them what language they speak, and then the messaging channel that they'd prefer to receive their messages from. Okay, and now let's jump into that piece here, the IVR language campaign. Here you can see that you can have multiple languages that you can incorporate into your campaign. You can have Swahili, you can have any other languages that you want in here. For my example, I have included English, French, and Spanish here. So now let's assume that at the beginning when you enroll them into your program, you don't know what language they speak yet. So you're gonna need to ask them that question first. So that whatever the response is for this question, you're gonna ask them what language do you speak. For English, press one on your phone. For Spanish, press two on your phone. For French, press three on your phone. Now, whatever the response is, they are then enrolled into the different their contact profile is updated with the language that they speak, so that the system can has it on record that that's what they speak, and so the succeeding messages that they will be receiving will now be in the language that they speak. So from here on, they if they say they speak Spanish, then they will receive this question, this mode of message question in Spanish. If they say they speak French, they will receive it in the French language. And now, since we're asking here what how do they want to receive the messages, if they reply one, if they press one on their phone, because they are still on the phone, right? They receive the phone call, they pick it up, they pressed one to say they speak English, and then they pressed one to say that they want to receive further communications via a phone call, or two for WhatsApp, or three for SMS. Now, after we know that um, that's how they wanted to receive messages from the program, then they are enrolled 5 minutes later, they are enrolled into the survey where you try to gauge where they are at in their learning and what their current learning at is. You can of course customize this into however long you want the waiting time to be. I just made it into shorter bits so that for the purpose of this demo. And now if they say, okay, I want to receive messages via SMS. So let's see what SMS looks like. So now we have here one thing that we normally recommend is having a consent question in here. Even though, let's say, you've already asked for their consent in person or in any other method, it's still a good practice to ask it again on your surveys. There's really nothing wrong in doing that. So yes, you have that question in there, and if they say yes, then they proceed to the rest of your questions. But if they reply no, then you have a goodbye message in here, and then they get removed from from the campaign. They will not receive any further communications from you. And for those who says yes, they want to take the survey, then they are presented with 5 questions. You can of course have as many questions as you want in here, just like in my earlier example with NRI, with University of Greenwich, where they have 88 questions. They've played around with skip logic in there, but you know, you can have as many questions as you want. There's no limit to it. And now, whatever the response is, however they respond to your wash related questions, then they proceed to your next questions up until the end of at the end, the last question. Now, in here, once they've completed the baseline survey, you can then automatically enroll them right then and there to your drip, to your educational drip campaign. And you can, again, you can change this to however long you want the delay between campaigns. Um, Now, let's look at the drip here. So the drip is if your drip is going to be like JHU's Johns Hopkins University's drip, where it's a 3 month long weekly engagement with the participants, then of course you'd expect that there would be more messages in here. For this example, I've only limited it to five, wherein they will receive the first message about water safety, and then hand washing practices, and then proper use of toilet and food hygiene. And then if somebody is sick, especially if it's a child, then they start seeking help and providing um, first aid to the child. And yeah, so each of these messages in your drip are going out on their own timing. So you can set this, okay, the first message goes out right away, the second message can go out a week later or a day later, or however many days you'd want it to be. The same goes with the other messages in here. So that's for the drip. That's how you incorporate education, the educational bit into your wash program. Now, I'd also like to show you what IVR looks. So if you're doing an IVR survey, this is now how they can reply. Unlike SMS, they'd have to reply with by actually texting you back, right? With their answers. Now for IVR, they will be on a phone call with you. They're basically a captured audience where they are on the phone call, they're staying on the call, and they're pressing digits on their phone to answer your questions. Now, for the consent question, you're asking them, do you want to take the survey? Press 1 for yes, press 2 for no. If they press the number 1, then they proceed to your questions in here. If they press 2 for no, then the goodbye message plays, and then the call will hang up. And for those that successfully proceeds to the rest of your survey, then they get asked these questions. And these are I've made it a bit simple, but we've seen other campaigns. The platform is very easy to use, but it can also get complicated as depending on how you'd want it to be complicated with your project. But yeah, so here, since I only expect them to reply numbers by pressing digits on their phone, I've used a range here. So any digits that they press between 1 to 8 will be accepted by the system. And we've enabled retry calls in here, that if they do not pick up the call, this is one essential thing about the JHO project, because not everyone's going to pick up the call, the phone, the moment you call them. So we have a retry, automated retry that captures that. So we will try again, let's say an hour later if they don't pick up, and then try again 4 hours later, or a day later, or however you'd want it to be. And yeah, so that's IVR. And now for SMS, sorry, for WhatsApp, here you go. So WhatsApp is pretty much the same in terms of the interface, pretty much the same with SMS and voice. The main thing about WhatsApp is that, of course, you'd have some you can incorporate some images in there, some images, some voice notes, some videos, and a file. And instead of them pressing digits on their on a phone call, or texting you back a number or something, they can just press buttons. Because on WhatsApp, if you're asking them a yes or no question, and they have an option to just press buttons. And the same thing with SMS and IVR earlier. You can also have multiple languages in here. So again, since we already know at this point what language they speak, now each of your participants are receiving the questions in the language that they've selected. So if they speak Spanish, they receive all of these questions in Spanish, and so on. Yeah, so that's pretty much how you can put things together in the platform. It's very easy, and it can be straightforward, but like I said, it can also be complicated, as how depending on how you'd want the flow of your campaign is going to be. So here, there's basically a flow here that I've created, that if they've completed the SMS survey, they then automatically gets enrolled into the trip, and same with the other flows in here. So not everyone in our clients are using everything, although we do have some customers who are using uh, a lot of our everything that the platform offers. But it's of course deciding on what tool, deciding on what messaging channel would suit you depends on a variety of factors. One is of course budget. Second is your target audience. Like, who are these people? Do they can they read a text message, or are they would they prefer receiving a phone call, or do they have access to a smartphone and things like that? So there's a lot of things to consider in deciding how you'd want to deliver your messages. And I hope this demo gives you some ideas. And if you'd want to brainstorm some ideas with us in the current project that you have, we can set aside a one-on-one discussion. Just let us know. We can set aside a separate meeting for that. I'd pretty much love to brainstorm some ideas with you, with each and every one of you, on how you can use the platform. Rachel?
Thank you so much, Christine, for the demo. That's usually
Yeah.
my favorite part. Yeah.
And so you can also scan this QR code to try out the demo. The demo is the one that I've shown you just now. So if you scan this, you will receive, it will bring you to WhatsApp. If you have WhatsApps on your phone, then just press the send button in there. When it brings up WhatsApp, there's gonna be a pre-filled text on the text box that says wash. Just send it, and then the flow will start rolling for you. It will send you an SMS, it will send you a phone call, depending on what your answer on the phone call is. If you want to take the drip or the survey via SMS or via IVR or via WhatsApp, then it will flow out for you, just how you'd want it. What your answer is there, for the questions. One thing to note though, the SMS survey part is, currently it only works for this demo. Of course, it works for those with US phone numbers, with Philippine phone numbers, with Pakistani phone number, and if you're from Ghana, it would also work, because those are the four countries that I've included in the demo to have their own dedicated short codes and numbers. For other countries, one more thing to note also is that when you do SMS surveys, you cannot really do SMS surveys across all countries, because it depends on the availability of a short code of a two-way number. If it's possible for that country, then of course we can help you with that. If not, then IVR would be the best solution. Now, in some countries it's possible, but getting a short code takes time. So that's why I've only included four numbers in there, because that's what we have currently. If you are based in a country that not mentioned on that I did not mention there, then we can have a look and see if we can get a short code for that country and see if how long it will take for for your program in case there's a need for that. Yeah. So please feel free to try out the demo and let us know what you think. And I see some people are already sending their questions. We'll cover that at the end of the presentation. Now, overcoming challenges in digital engagement. So, of course, if your survey is very long, like if it's a 20, 25, or even 40 question survey, expect that there will be drop offs. People will there's a thing called survey fatigue. So the longer your survey is gonna be, higher chance of people dropping off increases. And so one thing to mitigate that is first offering an incentive at the beginning. It's one of the features in the platform that you can build into your survey to automatically send airtime top up to your program participants. We've had clients use that, and it has proven to be effective in increasing the completion rate. We have a case study about that on the website. So survey drop offs, offering incentives, like mentioning at the beginning that if you complete the survey, you will receive 1,000 shillings or $1 or something. And then if your survey is really long, like it's a 20 question survey or a 30 question survey, then in the middle of it, like let's say on your 10th question, you can have some encouragement there that says, hey, you're already almost halfway into the survey, please keep going. And at the end of this, you will receive your airtime credit, something like that. And poor localization, that's also one of the challenges, because of course, if if you're engaging people in remote places, they have they prefer to receive your communications in the language that they're familiar with, in the language that they speak. And you it's ideal, it's recommended that you'd offer your campaigns, your messaging, your engagements basically in multiple languages. Just like what I've shown earlier on the demo, we have different languages in there. You can take full use of it, and it's always best to deliver your messages in the local languages. And safety concerns. Yes, of course. That's we take this highly, and that's why earlier I mentioned that we'd really recommend that you ask for consent when you do your surveys. That at the beginning of your surveys, you can ask like, do you want to take the survey? Even as simple as that. If they say yes, then of course you can proceed to the rest of your questions. If they say no, then of course you stop from there. You say goodbye and then drop them off from the program. And at the later end of your survey, you can even ask another question that says, do you want to continue receiving surveys like this from our program, from our organization? And if they say yes, then of course you proceed and such. And at the same time, one very important thing that I wanted to tackle for safety concerns is that um we handle PIIs, right? Personally identifiable information, and of course there's a risk to that. And that's why we basically built the platform to make sure that you're the only ones who you and the people that you invite or add as users in your account are the ones who have access to your account. And we have set up two-factor authentication in the system to make sure that there's a second layer of protection, basically, so that nobody can log into your account if they do not have your authenticator app. And other than that, if for whatever reason we needed to investigate any issues about your campaign, because the calls are not going, or SMS are not arriving and whatnot for whatever reason, then we'd of course ask for permission to conduct the troubleshooting and go into your account to investigate. And there is several layers of approval that we at the support team have to go through before we can actually go into your account. We'd have to send a request to our CTO and our CEO, and to approve that request for us to gain access to your account and see information um, that would otherwise just be available to you. And if you're done with your program, then of course you can have us delete everything. Everything will then be purged from the system, and basically you are the owner of your data. Okay, so I've included a another example here on how one of our customers are using us. This is not wash related or even meal related, but I this is a very interesting project because the way that they use the system is quite unique. It's centered towards early warning system. So the way that they've used the system, the way Catholic Relief Services or CRS use the platform in Ethiopia is that they have this monthly looping IVR. Um, that are sent to their field workers. The people that they're engaging are not actually the farmers or the end users. It's their field workers. They're interviewing their field workers because their field workers are the ones collecting data on the field and talking to the farmers and getting information from the farmers. And then the system calls them to collect those data to get information like, is it rainy season in this community? Press one for yes, press two for no. Is it how is the water level of the river in this community? Is it high, low, and so on? And then it's a recurring monthly interview that the field workers are receiving. And as soon as they complete that IVR phone call, they are then enrolled into a CADI survey. CADI is now more on the one-on-one phone call with the with the field worker and their supervisor. So after the field worker completes a survey, the supervisor jumps in and reviews their responses, what their answers in the survey is. And if there is any discrepancy in how they answered the survey, the supervisor can then jump in and call them, and using the system, using Engage Park to call them on their cell phone and say, hey, something is wrong with your answer. Can you verify whether this is correct or wrong or something? And once they're done, then of course the supervisor can tag that interview as complete. And one important thing in this cycle is that at a week later, when that interview happens, the supervisor receives an email from the system if there is still some calls that they haven't reviewed, to remind them that hey, you need to review this call. And so it goes on a loop monthly, and it's quite interesting. It was built in such a complex way, so I thought it's worth sharing. But it's quite it's fascinating, to be honest. Yeah. And now here, I'm not gonna talk a lot about the project here, but I'm just gonna show you the numbers. This is for more on the monitoring and evaluation front, where Root Capital are collecting data from their program participants. So they've sent millions and millions of messages throughout the program. They've been using the platform for a few years now, up until now. And yeah, they do baseline surveys to the farmers to gauge what they know at that moment, and then they after the baseline survey, they are sent educational farming tips. And at the end of the program, at the end of the planting season, they are sent an endline survey to then understand whether there's been a behavior change, if there's been a change of behavior with the farmers that are part of the program.
Thank you so much, Christine. The use cases from the organizations we've worked with are actually endless, and a number of them are very unique. So we have organizations that use us for hotlines, for support, and some that do missed call campaigns just to spark the interest of their participants. We have organizations who've used our platform to create whole soap operas that are built with quizzes just to educate their participants. And if you want to send airtime to your participants, like Christine mentioned earlier, as an incentive, then it's very easy to do on our platform. If you want people to maybe send in a keyword like hygiene and probably just get back information to do with opening hours of, let's say, a clinic or the nearest health center, then you're able to do that on our platform. So you don't need to build a new app or a new system. You just need to plug into what people are already using to communicate. And if you're also using maybe other tools, like you're sending out agents to the field to collect data, you can also integrate our platform into such a process. So I just want to let you all know that the magic is not in the channel that you use, it's in how creative you are in mixing the different tools available to engage the communities. And if people can actually leave a missed call or just beep a number and receive the help that they require, then that's all it takes. Communication on our platform is actually built for this world, which is full of chaos and just messiness, a lot of spottiness when it comes to networks, and for low literacy people. And it's also just built to help you scale up your engagements. So a lot of top universities, NGOs, UN agencies, and global businesses, like you seeing on my screen, actually use Engage Spark. And the reason they use our platform is because it actually works. It's very flexible and it's also inclusive. As you've seen, we have organizations that have been able to reach people who actually didn't have phones by being creative. And we also built for real world complexity. So whether you're doing a randomized trial in Bangladesh, or maybe you want to run a wash campaign in rural Kenya, or just collect data from people, then the tools are the same and they all work. You just need to target the right people with the correct tools. Now, I think we'll get into some questions, the questions
Yeah.
that came through. So Christine is
Yeah.
going to take it from here.
Okay, so I think we have two similar questions here on data privacy and building trust. I think they're the two are basically related. So I'll address them together. So data privacy and basically ethical practices are central to how Engage Park operates. You can include, like I mentioned earlier, you can include a consent question at the start of your question of your survey that says press if you want to take the survey, press the number one on your phone. If you don't want to take the survey, then press the number two. So that's already in a way to ask for consent. And we follow GDPR principles, so we are very much GDPR compliant. Participants data are secured, they are encrypted, and they're only accessible to authorized users in your account, which is, of course, you have full authority on who in your colleague in your department or your colleagues will have access to your account. If it's just you, then fine. If you want to include other people, then you can set different roles on what exactly they can access. And you can also choose to anonymize the responses for your survey, and you can delete at any given point in time that you wanted to delete the phone numbers in the system, you can do that. You can delete them anytime you want because you have full control of your account. And you can also, one thing that we also encourage people is having an opt out option. So if if you have a number that people can opt out into, you can send a message that says, hey, if you want to stop receiving messages from us, just text the keyword stop to 1234 to unsubscribe from our messages. So I think those are the key things in ensuring that your project is working within the context of ensuring that that the data are secured, and then that you're building trust with your participants. Um, we have another question here. By the way, if you have more questions, please feel free to type them in. If we run out of time in answering these questions, we can put them together in an Excel file and then share it over to everyone, so you see our responses. So now to address another question, how do we get participants' phone numbers for a program like this? Normally, our clients are the ones who are bringing in their database, the contacts, the phone numbers of the people that they want to engage, and they upload them into the platform and then start pushing out messages. Now, in cases where you do not have the phone numbers of the people that you of your target audience, there are two options. One is by we can get you a toll-free number, either an SMS number, a voice number, or even via WhatsApp, that you can then advertise to advertise on social media, on flyers, on health centers, wherever, to allow people to opt in into the program. So by letting them opt into your program, that's already them giving you consent, right? So that circles us back to the data protection and the security. So yes, you can have people opt into by texting a keyword to a number, or by dialing a number, having a missed call, or by texting a keyword to through WhatsApp. That's one option. Second is, if the budget permits, you can do random digit dialing, where you generate random phone numbers. Another Johns Hopkins project in Colombia did that exactly. They did a public health research in Colombia, and they don't have the phone numbers of the people that they want to collect data from. And because of the nature of this project, it's a nationwide public health research. So what they did is they generated some random numbers, they pushed out some calls into these random numbers, and of course there are a lot of calls that failed because for reasons like the number do not are not valid, they're inactive, and for a few other reasons. And for those that were actually picked up, they got some responses out of those. And because this is an RDD project, they also offered incentives just to encourage people to actually participate. And especially that their survey then was really long. It was like 30 or 35 questions. So they did that. So that's two options. Where is the data stored? The platform is cloud based. It's a web platform. You can just create an account online on our website, and it's cloud based. All our servers are in Europe, in Germany. So you don't really have to download anything. As long as you have a computer, you as a program implementer, you need to have a computer or a laptop and internet to actually implement this program. But for your recipients, they just need to have a cell phone. Um, what is the minimum running cost for the type of system? It depends. The cost really depends on what kind of program you're running, how long you're going to be running it for, how many participants are you enrolling into the program, and how many messages are you pushing out. Are you doing SMS? Are you doing voice calls? Are you doing WhatsApp? It totally depends on a lot of those factors. if you have like a specific project, we can probably talk about it. And then I can give you a cost calculator just to give you some estimates on how much it would likely cost. Um, okay, I think those are the questions. Okay. If after all this, if you realize you still have more questions, feel free to send us an email, or send Rachel an email. Yeah.
Okay. Thanks, Christine, and thank you so much to everyone for spending this part of your day with us. And we hope you're walking away with a few new ideas on how to run your campaigns and how to just engage, how to run your project, sorry, and how to scale up your engagements to the communities that you serve. Christine?
Yeah. I hope there's been some learning around this. And again, I just wanted to mention that if you have any project in mind that is not yet fully formed, and you wanted to brainstorm some ideas on how you can incorporate Engage Park into this project, let us know. We'd be happy to set aside a separate call where we do this talk, brainstorming ideas, and showing you the platform in much more detail. And yeah, thank you, everyone.
Thank you. Bye.
Thank you. Have a good day.
Thank you.
Yeah.
Thank you. Bye.
Bye.